Okay, well, I think I will go ahead and kick things off. Dean Ojo. So welcome everyone. My name is Jordan Snow and I'm the Director of Alumni Relations, and I'm very excited that you all could join us tonight. It's great to see so many of your faces, and we have a wide range of guests that are with us. So before I introduce our speakers, I wanted to announce, as you might have heard just a minute ago, that we are recording this event. And I wanted to provide a quick overview of the details and just share a few Zoom tips for us. So we will kick off the event with a moderated conversation with Dean Ojo, and we will also have the opportunity to hear from our Dean in Wichita. So please mute your microphones during this time. We'll cover important updates happening within the school, present questions submitted by alumni ahead of the event, and encourage everyone here tonight to participate by typing questions in the chat throughout the duration of our conversation. So feel free to test the chat feature now by saying a quick hello, and we will make sure to get to your questions as we move along here tonight. So now I would like to start by introducing Dr. Ojo, our Executive Dean of the KU School of Medicine. Dean Ojo earned his medical degree from the College of Medicine at the University of Lagos in Lagos, Nigeria. He also earned a PhD in epidemiology and an MBA from the University of Michigan in Ann Arbor, where he rose to the rank of full professor in the Department of Medicine. He was also inaugurated as the Florence E. Bingham Research Professor in Nephrology, becoming the first African-American to be granted a named endowed professorship at the University of Michigan Medical School. After medical school, he served as a postdoctoral fellow in public health at the University of Alabama at Birmingham, and he continued his training at the University of Kentucky Hospitals in Lexington, Kentucky, where he completed an internship and residency and served as chief resident for internal medicine. He completed his education at the University of Michigan Health System in Ann Arbor, where he served as a clinical fellow and research fellow in nephrology. Dr. Ojo's primary research interests are in the clinical epidemiology and clinical and translational research in chronic kidney disease and kidney transplantation, minority health and health disparities, and global health. He has held leadership roles on major national programmatic initiatives, and we are honored that he began leading the School of Medicine here at KU in August of 2019. I would also like to introduce tonight Dr. Gerald Menz, who is Dean of the KU School of Medicine, Wichita. Dean Menz is a 1976 graduate of the school, and he went on to complete his residency and infectious disease fellowship in Wichita as well. He joined the faculty in 1980, and he currently serves as a professor of internal medicine and the associate dean for academic and student affairs, in addition to his role as dean. Dr. Menz has been instrumental in protecting the health and safety of Kansans throughout the duration of the COVID-19 pandemic, serving as the Sedgwick County's local health officer. So thank you, Dean Menz, for joining us tonight. All right. We may have one additional speaker, just TBD, Dr. Bob Mosier might be joining us if he's able. And if so, we will certainly introduce him and include him on some updates later on tonight. Okay, so Dean Ojo, let's get started. So I want to begin by applauding your leadership during the last year of unexpected and challenging circumstances. The COVID-19 pandemic has affected many of our plans, but it's also helped show how resilient we are. So for example, the School of Medicine did not have any interruption in the curriculum, and that was a rarity amongst medical schools across the country. Can you elaborate on that?
Thank you very much, Jordan, and good afternoon, everyone who has taken time this summer afternoon to participate in this conversation. To answer your question in a simple way, Jordan, I think there are two main factors that were responsible for our ability to meet all our academic medical school milestones during the pandemic period. One of those factors is the effort of our medical education and student affairs leadership And the second factor is the university-wide policies that were put in place and executed by the Executive Vice Chancellor and his leadership team. For each of the 4 medical school classes, and on all the 3 campuses, we were able to switch to virtual learning modes and telehealth clinical learning environment in a synchronized fashion very rapidly as soon as we suspended in-person learning activities. Our medical education leadership team under Dr. Julia Bonamino did an excellent job in being agile, flexible, and creative in leading our faculty and students to engage in those virtual learning modalities and telehealth. Our student affairs Dean, Dr. Mark Meyer, and the student health team also mobilized very quickly to support our students. And I'm pleased to note that because of the effort of medical education, student affairs, student health, and the cooperation of the student themselves with public health measures, that we were successful in reducing infection rates for COVID-19 among students and faculty to less than 1%, not a single hospitalization, and of course, not a single fatality from COVID-19. This is a remarkable feat considering the fact that both M1s and M2s were back on campus in the thick of the pandemic, taking exam every 2 weeks. Anatomy dissection was going on all the 3 campuses, and clinical skills learning activities were continuing. I think because of our success over the pandemic period, in 2 weeks or so, we will start academic year 2021-22 with all activities, all learning activities in person on campus, just as it was pre-COVID.
That's wonderful. Do you think there will be any long-term changes that the school will implement post-COVID?
There are a few changes that we implemented to be able to walk through the highest point of the COVID pandemic. One of them is the use of telehealth clinic for some of the clinical rotations. We anticipate that health system affiliates across the state will continue to use telehealth as a significant fraction of their clinical practice. And so I see telehealth as continuing to be an important component of clinical rotations for our students going forward. In addition to that, I think streaming of classroom activities for large group sessions is something that was very successful during COVID-19, and we will continue with that learning modality if Dr. Bonamino and his medical education leadership team decides that that's the way to go.
Wonderful. Thank you. Okay, so you have been here for almost 2 years. You came in as a research dean and you were immediately plugged into a rural health school. A lot has happened along the way. What do you see as the priorities that are going to take shape for the future of the school?
Thank you very much, Jordan. We have several priorities, but the 3 most important priorities that are immediate for the school includes our effort on rural health, our effort in securing more scholarship for our students, and thirdly, our effort to make sure that we continue to increase our research activities. Let me elaborate very briefly on each of those. With respect to the rural health, I think we are beginning to take meaningful steps to make the school more visible and more impactful through various programs so as to improve the health of the people of Kansas, especially people in the rural parts of the state. We're already implementing many programs. One of them is a Kansas Rural Health Center to be based in Salina that is in the process of being considered for approval by the Executive Vice Chancellor. That Rural Health Center will be under the leadership of Dr. Robert Moser, who is the Dean in Salina. The Rural Health Center will also implement several programs that have been mapped out in a detailed implementation plan that was developed by a multi-stakeholder rural health task force that was established in January 2020. I think as part of that rural health priority, we want to build on the legacy of Dr. Mike Kennedy, who is retiring as our Associate Dean for Rural Medical Education. We also want to build on the track record of our Wichita campus and numerous other programs in rural health that have been established going back more than 50 years in this school. One of the ways in which we will build on those legacies is to establish more rural track residency program in primary care specialties as well as in non-primary care specialties. In the area of rural health, the school is very fortunate at this time to have secured the commitment of Dr. Jennifer McKinney as our new Associate Dean for Rural Medical Education. And Dr. McKinney will continue her practice in Fredonia, even as she takes on this new role that was previously held by Dr. Mike Kennedy, who is retiring, but will also continue as part of the school faculty and leadership in leading the effort with one of our rural track residency in Pittsburgh. The second priority has to do with scholarship for all our medical students. At the present time, we are in the 47th percentile in terms of scholarship funding among all medical schools in the country. And that is even with the Kansas Medical Student Loan Program. If you took out the Kansas Medical Student Loan Program, we will be somewhere in the 25th percentile in scholarship funding for our students. So we're working very hard to increase scholarships, and our endowment team, for whom I'm very proud of, is working overtime to seek philanthropy for scholarship for all our medical students. Along those lines, we are also trying to expand the pipeline program for African American and male and Hispanic medical students, especially that very small, extremely small group of students who are male African American medical students. Recently, our endowment team has been successful working with the private sector to secure a large scholarship for African American male medical students called the Barbara Sheffield Scholarship, which will allow 7 male African American students to start medical school in a few weeks with full scholarship. And this will be one of the largest cohort of male medical students of African American descent in any one medical school, except for the historically Black colleges. Research is also a priority for the school. It is a priority in the intermediate horizon because it takes time to recruit physician scientists. It also takes time to train physician scientists. We are looking at ways of expanding our MD-PhD program that has recently been funded by the NIH to include training in clinical and translational science. Our basic science faculty has not grown in over 2 decades. And so we are looking for ways to improve the number of faculties in the basic science departments. On the whole, our goal is to be the best medical school in the country, and maybe the best medical school, not in terms of NIH ranking or US News and World Report ranking, but the best medical school in improving lives and communities in Kansas and beyond through innovation in education and research and service.
Thank you. You had mentioned US News and World Report rankings, and I just wanted to make sure that our group here tonight has heard the news about the rankings for 2022. Can you elaborate on the details for how the School of Medicine ranked for 2022?
Yes, I'm delighted to speak on that great success. So in the US News and World Report ranking of medical school for 2022 that was released a few months ago, 180 medical schools were ranked for rural health and research. Our school was ranked number 9 in primary care among all the 180 programs. This is the first time that the US News and World Report will rank our medical school in the top 10 for primary care since the ranking has been going on. And then we were successful in achieving that high rank, I must say, because of the decades-long effort of our medical school leadership in Wichita. Wichita continues to produce the highest fraction of students who go into primary care. It is also in part due to the effort of our primary care departments in Kansas City, especially the Department of Family and Community Medicine, as well as the effort of the school in Salina, where in 2020, 100% of graduates from Salina went into primary care residencies. So it is the effort of different areas of our 3 medical school campuses that has made this high ranking possible in primary care in the US News and World Report.
Thank you. I want to rewind a little bit and talk about telemedicine a little bit, and then maybe open it up to Dean Menz to maybe touch on some of the specifics that maybe the Wichita campus is working on regarding telemedicine.
So would you like me to go ahead and discuss that?
That would be wonderful. Yes, if you don't mind.
Well, one of the, we had telemedicine been going on at KU for years.
Mm-hmm.
But when the COVID pandemic hit and a lot of the medical practices saw the number of patients coming in to see them because of the restrictions and the lockdowns, they had to adjust real quickly and expand their telemedicine way beyond what we had been doing before. Before, we were mainly doing telemedicine in specialty care like oncology, and that was mainly to follow up patients who had been seen originally at the medical center. But with COVID, we had to figure out how we were going to do telemedicine for almost every specialty. So the departments were very creative and very efficient in getting telemedicine equipment installed. Unfortunately, the telemedicine equipment needed to do telemedicine nowadays is much more available than it was when we first started doing telemedicine at KU. I mean, obviously, now you can do it with FaceTime, and if you've got a laptop or iPad or whatever, you can set it up pretty fast. And that was one reason we were able to keep our 3rd year medical class going, because of various restrictions. Hospitals were a little uncomfortable with our students coming into the hospital because of inadequate personal protective equipment. And so we had to cut back the number of assignments within the hospitals, but our departments were very facile in being able to ramp up with other modalities of teaching our clerkships and keeping the programs going, even though we had to reduce the amount of patient contact in our clinics and in our hospital. So I think we learned a lesson there, and I think our departments are seeing telemedicine had some real advantages for both patients and doctors that we're now considering maybe doing that on a more consistent basis, even though the pandemic is, for the most part, calming down, and we're certainly not having any lockdowns now. But a number of patients have commented, boy, it sure is convenient to do this telemedicine thing. I could do it from my home. I don't have to get the car. I don't have to go find a parking spot. And wow, this is pretty nice. And a lot of doctors found out too, you know, this is more efficient. We don't have the waiting rooms quite as packed full. And for many visits that don't require much of a physical examination, where you're just rechecking meds or reporting on laboratory results, it's actually, in many respects, more efficient. So one, it helped our curriculum keep going. And number two, I actually think it's improved patient care. And we've learned that we can do it beyond the limited specialties that we were doing before the pandemic hit. If it's okay, if you could add one more thing.
Please do, yes.
Dr. Ojo reviewed very adequately and completely about the ability to keep our curriculum going with the lockdowns that occurred because of the pandemic. I just alluded to the fact that our 3rd year students had to reduce their patient contact in the clinics and whatever. But the other requirement that KU has before the 3rd year students can start the 3rd year is they have to take and pass step 1 of the board examinations. Unfortunately, when the pandemic hit and the lockdowns occurred, the private testing centers that administered step 1 closed their doors right before the students were about ready to take the exam. And of course, our students were in a panic. What are they going to do? But fortunately, in the late 90s, the testing programs allowed medical schools to apply to propose a testing center in their medical school campus. And KU Wichita was fortunate in being given one of 5 opportunities to have their own testing center And because of that, despite the fact that private testing centers closed down, our medical school-based testing center was able to continue on, and we got all of our students tested from all 3 campuses. Took a lot of efforts by the staff to staff that almost 7 days a week, get it all done within about a month's time. But so that was another major factor in keeping at least our 3rd year students able to continue their 3rd year. Thank you for letting me add that in.
No, I'm glad that you covered that, because what an amazing feat that you put that together so quickly, and the students were able to continue on without interruption. So yeah, thank you for covering that. I will keep you on, maybe Dean Mins, and have you continue talking about Wichita while we're on the topic. So as many of you probably know, that Wichita is celebrating their 50th anniversary this year. So Dean Mins, you share most of the school's history, having graduated with the 2nd class of medical students. And could you tell us a little bit more about ways that you are looking to continue the visionary spirit and community involvement that formed the foundation of the campus there in Wichita?
Sure. I might just turn the clock back a little bit and say a little bit about our founding. And in the late 60s, the KU School of Medicine decided that our class size of around 120 students really wasn't large enough to meet the needs of our state, and started exploring ways to expand the class. They had to do that, they would have to expand their teaching facilities for the first 2 years, classrooms, anatomy labs, things like that. But they also would have to expand the opportunities for students to do actual clinical work in hospitals and offices in the 3rd and 4th year. And unfortunately, at that time, they could not create enough additional clinical training sites in the Kansas City metro area for the students if they wished to expand. So they did explore the opportunities throughout the state, and it was eventually decided, and Wichita agreed, that they could establish a regional campus in Wichita, which originally was just for 3rd and 4th students. So they went ahead and expanded the class, and that expansion was enabled by seeing those additional students that were admitted into the class to come and do their 3rd and 4th years in Wichita, and enabled KU to expand its class and have a class size more suitable for the needs of Kansas. So the legislature Board of Regents approved the campus in Wichita in 1971, which, as you mentioned, this is 2021. So that's depending on when you count the date we started, but we didn't actually matriculate students here until 1974. It took a couple of years just to get all the resources together and housing and all that. But we've been in operation now officially by the Board of Regents for 50 years. And I must say, times have changed. When we first started providing education here in Wichita, all the local hospitals were privately owned by local boards and administered by people from Wichita. Back at that time, almost all physicians in practice were in private practice and physician-owned clinics. 50 years later, both of our hospitals are members of national corporations. And increasingly, less than half of physicians now are in physician-owned practices. So the world has changed around us, but fortunately for us, our community faculty in Wichita are still committed and dedicated to taking our students for their education in the clinical arena. Our hospitals are still very loyal to the school and are still doing their best to provide hospital-based training for our students. And we're just so grateful that the community of Wichita has just come together for 50 years. And despite the changes in how medicine's being practiced and how medicine's delivered, they're still committed to provide that education for our KU students. So I think that's really remarkable considering how much medicine has changed. The practice of medicine has changed in 50 years. I might add some of our goals. As everyone I believe knows, Wichita now has all 4-year classes in Wichita. So we have a cohort of about 28 freshmen who start classes here and do their entire 4 years here. And then we still take a cohort of students from Kansas City to do their 3rd and 4th years here after completing the first 2 years in Kansas City. So we're now up to about 70, 75 students in the third and fourth year. So we add about 75 students to the graduating class every year. One of our, we're very proud of that history, and I think we still do an outstanding job of providing them clinical training that prepares them well for their residencies. We originally, when the campus was formed, research was not a focus here. The legislature really didn't see this as being a research-intensive campus, but we feel that's important for us to expand that too, and we are getting more involved in clinical research. We were getting more involved in clinical trials. We have been involved in one of the clinical trials that was important in getting one of the COVID vaccines progressing through its approval process. We hope to build upon that and expand that.
Thank you, Dean Mintz. I just would like to remind everyone that we would love your questions. So if you do have a question for Dean Mintz or Dean Ojo, please don't hesitate to type them into the chat. Okay, so Dr. Ojo, will turn it back over to you, and was hoping maybe you could talk a little bit about LCME accreditation. Can you touch on maybe the survey that's happening in October and all of the logistics that go into preparing for that visit and kind of the responsibilities of the school for that visit in October?
Thank you. The LCME reaccreditation survey occurs every 8 years. I believe everyone understands that that is the license to operate. So it is with an LCME accreditation that we can remain as a legitimate medical school. We are 3 months away, as Jordan pointed out, for our next reaccreditation survey, October 4 to 6 this year. It is a comprehensive evaluation of our medical education program that covers organizational structure. It covers the functional integration across the 3 campuses, how satisfied are the students with all aspects of their medical education, the diversity of our students and faculty and senior administrative staff, the services, the support services that the students receive. And because we are a multi-campus school, a great deal of emphasis in the survey will be placed on comparability of the experiences across our 3 campuses as an important evaluation criterion. We are making sure that all our programs across the 3 campuses fits into what we have been saying, that is, we are one school, one medical education program, and 3 campuses. We have gone through 2 mock surveys, one in April this year and one in January of 2020, to help us prepare for the reaccreditation in October. And the leadership of the school is very confident that we are well prepared. In the next few days, we will be submitting final data collection instrument materials and self-study documents to the LCME that they will review and will be the basis of the focus accreditation visit. This year, unlike the last accreditation in 2013, because of the pandemic, and in order to make it a level playing field for all schools that are being reaccredited, it will be a virtual visit. That is a disappointment for us because it will deprive us of the opportunity to showcase our health education center in Salina, our updated physical plant in Wichita, our health education building in Kansas City, as well as a new anatomy dissection lab, which are all state-of-the-art facilities that were planned and built with significant support from the alumni.
Thank you. It looks like we did have a question come in on the chat. It's a question for you, Dr. Ojo. Did the changes imposed by COVID have any effects on the emotional and mental health of students?
We did experience an increase in demand for mental health and support services by the students during the last 16 months. We met that challenge by making sure that we provided incremental support in terms of mental health professionals to meet the needs of our students. One group of students who have not had the opportunity of having full on-campus education are those who are going into the M2 year this July, that is those who started the class of 2024. For those group of students, one of the things that have helped them, especially in developing professional identity, as well as in mental health support, are the learning communities and the academic societies that are all part of our new ACE curriculum.
Thank you. All right, so I also was hoping to maybe touch on any other, you had mentioned with the priorities, and I don't believe that that Dr. Bozier is able to join us this evening, but is there anything else in addition to kind of talking about telehealth and remote learning that the Salina campus, anything else to highlight, or any updates specific to the addition to their learning facilities there for the fall?
Yes, the Salina campus is a beautiful physical plant. I would urge anyone who is traveling by Salina to stop by. The last time I was there, which was in April, I joked that if I have to go to medical school today, I would choose the Salina campus. That is true. There has been an increased expansion on the northern part of the building that represents the health education building in Salina. It is now a facility that can accommodate, I believe, maybe more than 40 or maybe even 64 nursing students without encroaching on our complement of 32 medical students. There is a state-of-the-art anatomy dissection lab with augmented and virtual reality components that was made possible by our alumni on the 3 campuses. We also have in Salina a simulation center to complement the Zamrowski learning, experiential learning laboratory here on Kansas City campus. So the facility there is also going to be accommodating the Kansas Rural Health Center, which has its offices and space there in the expansion.
Thank you. Talking a little bit about that you had mentioned simulation and those types of new kind of technology and ways of learning. Can you maybe talk a little bit about like the integration of interprofessional education between the nursing, medicine, and health profession students, and maybe how that has impacted student learning?
Yes, the ZEAL facility in the new health education building has really transformed interprofessional education among medical students, students who are in the nursing school, as well as students in the School of Health Profession. In addition to those 3 professional school students participating in interprofessional learning there, staff members and faculty who are working in the health system are also participating in interprofessional activities along with the student. So that what we have in ZEAL at the present time is one of the most sophisticated and advanced interprofessional education modules that were developed under the leadership of Dr. Emily Diedrich, who is the director of the SEAL Learning Center that brings together students from the 3 schools, as well as staff members, nursing staff, and faculty from the health system and the medical school, all of them learning together, simulating the real world and gaining more experience.
Thank you. And I will make a shameless plug for Alumni Reunion Weekend. We are going to feature a session on October 1st that will kind of cover, Dr. Diedrich will be leading a panel with faculty members from all 3 of our schools and talk about simulation and how the students are learning right now. So alumni here tonight, there will be a sneak peek and you will be able to see kind of firsthand how the students are learning come fall. So great, thank you, Dr. Ojo, for covering that. Okay, so I did have a question from an alum that was submitted ahead of the event tonight. We'll shift gears a little bit. This question is related to diversity here at the School of Medicine. So the question states, diversity is most often spoken of in terms of race, ethnicity, economic status, country of origin, gender, age, but rarely affectional preference. What plans does KUMC have to recruit non-heterosexual applicants and offer course and clinical work regarding lesbian, gay, transgender health and wellness?
Thank you very much, Jordan. Let me attempt to answer that question, and Dr. Means may contribute as well. The school has a policy of inclusiveness and promoting an atmosphere and culture and climate of belonging and supporting all groups of students, staff, and faculty, regardless of their creed, their skin color, sexual orientation, or background of any dimension. These principles are enshrined in our human resources policies. They are enshrined in the faculty handbook guidelines, and they are emphasized vigorously in our educational program. The questioner was making a point that we don't mention affectional categories only when we are talking about LCME diversity requirement. For the purpose of the LCME, there are specific mission-appropriate diversity categories that the school is expected to report on. For medical students, the diversity categories that have been established and put in place, that the LCME will be looking for the school to demonstrate programming as well as outcomes for Native Americans, Native Americans and Alaska natives, Hispanic, Latino, Black or African American, Vietnamese, Laotians, and Cambodians. For faculty and senior administrative staff, they include women, African American, Hispanic, Latino, Native American, and Alaska Native. These categories are established or were established a long time ago and on record at the LCME as areas in which we will have specific programming in order to increase student representation as well as faculty and senior administrative staff representation as appropriate. It does not preclude us from embracing, encouraging affectional categories from coming to a medical school. And I will say that we have created a climate here that welcomes all groups of people. And if you come on this campus within a 3-month period, you will experience some type of activity that is celebrating different types of group. In this year alone, we celebrated the Black History Month. We celebrated the Asian Month last month. We celebrated the Pride Month this month. We recognized and marked holidays, including Rosh Hashanah, the Ramadan, and the Easter holidays. So we embrace all group, and there is no category of individual, racial, ethnic, religious, affectional, that is not welcome, supported, embraced, and encouraged within the environment of our medical school on the 3 campuses.
Thank you, Dr. Ojo. Yeah, I don't believe I had any other questions that were submitted ahead of the event, and we don't have any in the chat. So I was hoping that maybe we could just talk a little bit about maybe some of the exciting renovations that have gone on in Kansas City while during the past year. You had touched on our new health education building, which everyone is familiar with, but do you have any other highlights to share just of things happening here in Kansas City? And then Dr. Menz, if there's anything you would like to highlight in Wichita, I would turn it to you as well.
Dr. Menz, do you want to go first, or do you want me to?
You're muted, Dr. Menz.
Is giving me trouble. I don't have as many renovations occurring on this campus. Obviously, the Kansas City campus being much larger and older has had a number of recent, I think, remarkable changes in the architecture and the entrances to many of the buildings that Dr. Ojo can review. We haven't had any major construction projects on the Wichita campus for a number of years, but we've worked very hard to keep our building up to date and modern, and we've had new security fences, new security systems installed in our building so that the students can be sure that regardless of what's going on nationwide with all the unfortunate things that are happening with guns and whatever, I think we have done a lot of things to ensure our staff and our faculty and our residents, the building's fairly secure, and we have full-time security on board. And it's one of those things we don't like to have to talk about, but we think it's important to reassure our students that the campus is secure. Other than that, other than our annual maintenance and keeping everything modern, we have no major construction projects going on. And I would like to, I know of the major construction projects occurring in Kansas City, but probably be more appropriate for Dr. Ojo to have the privilege of bragging about those things because they've been very attractive.
So for those who remember the chapel on campus here next to the Murphy building, that chapel had disappeared. It is now replaced by the health system proton therapy facility that is near completion, and by the end of this year or first quarter of next year, our health system will be able to provide proton therapy on this campus. To replace the function of the chapel, a new reflection spiritual gathering area had been created with renovation within the campus facility that is also a very beautiful calming place to see. There is a botanical garden initiative with landscaping going on, especially in the front of the Murphy building entrance, which is now ADA compliant. There is an Oculus Heart installation in the courtyard of the health education building. That is also an impressive sight to behold. Those are some of the main, more recent renovations that have taken place. And of course, for those who have not seen the health education building, it continues to be the gem of our campus, and it continues to win national award for its architectural design and functionality in medical education.
Dr. Ojo, if it's okay, I'd like to compliment the Murphy entrance. You've just alluded to it, but I would urge anybody who's in Kansas City, they need to drive by that Murphy entrance. It's just remarkable how the architects have made that so convenient to get to. And before, the concrete around the steps and everything were deteriorating, so they just totally tore out everything. And it's just a remarkable appearance. It's made that building look so much different to me.
Yes, I agree, Dr. Mins. I'm actually looking at it right now, right out my window. So I feel very lucky to be able to peek out and see those renovations. Thank you for those updates. That was great. It looks like we had a question in the chat saying, was it hard to train medical students in physical exam and other diagnostic techniques like ultrasound when visits were virtual during COVID? And how did you fill this need?
We continued clinical skill training during the COVID period. We were fortunate that the M3s at that time were about to begin their last rotation when we had to suspend in-person learning activities as demanded and as was necessary by our clinical affiliates. So those group of M3s were at the very end of their clinical rotations. So most of those experiential learning with ultrasounds and other modalities had been completed for the most part. By the time this next cohort of M3 started school, our clinical affiliates had allowed students to return to the clinical learning environment. And with appropriate precautions and social distancing, mask wearing, and hand washing, all clinical learning activities resumed a few months after the suspension took place on all the three campuses.
I might add, actually sonography, physical exam with sonography actually was a complement we could expand during the lockdown, because the lockdown really affected the hospitals and clinics. Our clinical skills facilities, including our simulation labs, could continue. We continue to have those occur because that did not involve the patients. And one reason the hospitals didn't want our students in the hospitals, they had to shut down all the elective surgery, so that really curtailed a lot of the surgery experience. But that didn't affect the schools building, so we were able to continue some of that. Unfortunately, you can learn a lot about sonography with people who are not ill. Just learning normal anatomy with sonography you can do with anybody. So I think we were able to continue some of that to a fairly adequate level, even when the hospital had essentially shut down.
Thank you for that. It looks like there is one other comment that is kind of piggybacking on the diversity topic, and there are people curious about LGBTQ within curriculum, and maybe how does that incorporate more into specific intentional discussions into curriculum and other training exercises that are involved with the medical students.
Well, I might add, in Wichita, we have actually an elective in the 4th year. We have some practice sets that specialize in caring for patients that identify themselves that way. And so students who wish to get more experience at their own initiative, they can do that. And we also have some formal didactic sessions in the first 2 years in our courses that pertain to sexuality and lifestyles. So I think we've adjusted to that. I suppose one could always say we need more, but I actually think there's quite a bit of it. And in my sense, the student body is very accepting of these courses and these concepts and seeing these patients.
Thank you. Wonderful. Well, I believe that is all that we have for this evening. I will turn it over to you, Dr. Ojo, if you have any final remarks, but I believe we answered all of the questions tonight.
Thank you very much, Jordan, and thanks also to our endowment team for making this town hall possible. We appreciate the opportunity to be able to have conversation with alumni body, as the alumni represents one of these strongest pillars of our school. And what you do as alumni is what makes it possible for us to continue to carry the mission that you have charged us with, and the mission which you yourself contributed to during your medical education and continue to support with your effort, with your resources at this time. We are working very hard collectively as a school with all our stakeholders, including the alumni board, to make sure that we continue to advance the mission of the school, which is to improve lives in communities in Kansas and beyond through innovation in education, research, and service. We are doing a lot of work on our research programs to increase our NIH funding, which will require recruitment of new faculty and physician scientists, and also train our own physician and research scientists. And so all these efforts together will only be successful if we continue to have the blessing, the support, and the partnership of the alumni. So thank you.
Great. Thank you, Dean Ojo and Dean Mins. This was wonderful, and thank you to all of our guests for spending your evening with us. We really appreciate you, and thank you for your commitment to the school and to the KUMC Alumni Association. Have a great evening.
Good evening.
Hello, Mike Kako.